Hey guys, it's Jeremy, your friendly respiratory therapist and nursing student. So today I'm going to talk about something that's very near and dear to my heart, and it's going to be how I became a respiratory therapist and what drove me to do it. So in order for you to understand it, we have to go back quite a bit. So let's go back in 2012. My father, Don, he ended up passing away from a stroke, to say the least. Passed away at the young age of 46. About a year later, I had a problem, which was Chiari malformation, and I had to have brain surgery to release the pressure. I knew after that point, at some point, I really wanted to do something in healthcare. I kept telling myself, travel nursing is something I want to do. Well, after my dad died, I pretty much did not care about school. My high school grades were C's at best. Never did anything like I was supposed to. Just wanted to pass and get done with it and move on with my life. And then I realized that was a big mistake because it was harder for me to get to where I am now, but also it made me grow as a person. So probably back in 2017, I became a nursing assistant, got my NA1 and my NA2, ended up working at a nephrology unit at the nearby hospital, which I had amazing management, had an amazing team. It's where I learned healthcare, just in general. It was funny, when I was new as a CNA, I was even scared to wipe a butt. Some of the nurses laughed, and a lot of them took me under their wing, and they know who they are. They're still around the hospital, and I see them to this day. I attempted to go to nursing school 3, 4, 5 different times, got into LPN school, waitlisted on the LPN school, never got accepted to RN. I was missing some classes, and some of my anatomies were low grades, and I was like, all right, well, maybe it's just not meant to be. One of my friends told me to look into respiratory, and he connected me with the program director of one of the community colleges around here, and I reached out. I'm like, hey, I'm so-and-so, I'm really interested in respiratory, and he invited me to come and talk to him, see what respiratory was all about. He was telling me about how respiratory therapists manage airways, hemodynamics, arterial blood gases, so much more. And I was just in awe. I was like, oh, this is awesome, I want to do it. So I found out everything I needed to do to apply, and I had everything done, and I had a second change of heart. I was like, no, I need to stick with nursing. So I didn't even end up sending my information in. Well, right before the program was about to start, and I messaged him again. I'm like, hey, I'm really interested. I'm sorry. Was just thinking some things through, and he was like, well, are you really interested? And I was like, yeah, I'm very interested. So I ended up joining the program, and let me tell you, it was the best thing I've ever done. They didn't look at me as someone who didn't belong there because of my past grades. Didn't judge me, nothing. I had amazing instructors, Tim and Josh. They saw my potential, and we went for it. I never have been an A student. Respiratory school, I made a few A's and some B's. 1 C, we all know you have those days and it just brings you down. But at the end of the day, I ended up graduating. I graduated in the middle of COVID, May of 2020, and took a job at the nearby hospital, did a respiratory care assistant for 3 months. Loved every bit of it. We were assisting as much as we could. I was running around the cancer center, the heart center. I knew that place from the front to the back. I knew where every hiding place was. I knew where everything was. That was my little area. Then I finally graduated in May. I was able to get my certified respiratory therapy and then my registered respiratory therapy, and I started in my new grad residency, and I had an amazing preceptor. Jessica, you taught me everything I needed to know. Well, it was all during COVID. I got to learn running APRV, pressure control, all the advanced modes, learning about critical assessment skills, learned how to stick for ABGs, protocol-based care, really, really, really bringing up that critical thinking that they teach you about in any healthcare program. So fast forward, got about a year and a half in, and I was working 60 hours a week. I was burned out. I was young. I was in my early 20s. And we all know we had our emotions when we were in 20s. So I decided it was time to leave. I decided to go traveling for 3 months, found a little hospital that was happy to have me. Got to intubate my first patient as a new grad or as a therapist. Working as a sole therapist, it was the most wonderful time. Every nurse knew my name. Every respiratory therapist knew me. The manager knew me personally, talked to me, asked my opinions. Well, this was near the end of COVID and travel contracts were dwindling down. And I decided, all right, well, it's time for me to find a place that I can feel like I can belong to. So I found the hospital I'm currently at now. Applied originally as a team lead, didn't get it. Applied as a traveler, didn't get it. So I applied as a full-time staff member, got in, was enthused. Had a great supervisor at that time. Stayed on night shift, and about a year and a half in, there was an opportunity for me to become a team lead, and this is where my career literally expanded. Because during this time, I finished my bachelor's in respiratory care from UNC Charlotte. I had my adult critical care specialist credential, already had my NPS, so I had everything I needed. Well, during that time, we were still running a VV ECMO program. My supervisor at the time asked me if I was interested in it, and at this point I was hitting my 2.5 year mark, and we have to be 2 years as a respiratory therapist in order to run ECMO. I said, sure, why not? So I went through the training, enjoyed every bit of it. I love critical care, the sickest patients. It's where you get the most problem solving. It's where you really get to dig down deep and you solve a puzzle. And that's just something that I enjoyed. I was able to be a team lead for about a year. That taught me so many ways how to mature, strengthen my attitude, don't stress things as much, just finding my way in life. Well, after about 3 years as a therapist, 4 years as a therapist, I was like, all right, I want more. I enjoy doing this. I enjoyed being a respiratory therapist all my life. Or as I've done it, I love communicating with the physicians, communicating with nurses, figuring out what the best plan was. So I decided, okay, I'm going to go into some advanced role. But I really want to do something where I have multiple options and I'm not stuck in one thing. So I decided, time to apply to nursing school again. And this was the last year. All my prereqs were still counted in. They were within the 10-year window. I took my TEAS test. The TEAS test was still within. I was like, you know what? I'm going to apply. So I applied to nursing school at my local community college. Got denied. I was heartbroken. I was like, all this experience and I feel like it's not getting me anywhere. Well, right after, I got a call about a month later saying, hey, there's a seat opening. Would you like to take it? And I did. So one of the hardest decisions I had to do, I had to decide if I wanted to go to nursing school or did I want to stay as a team lead. Well, ultimately, I ended up stepping down as team lead. I was eventually able to go part-time, and now I'm PRN. Nursing school will take all the time in the world out of your schedule. Still love my staff, still love the doctors, had so much support. I never felt as much as respected as I did at this place. I'm in my 4th semester of nursing school, going into my 5th semester, already accepted a job, going to be an ICU nurse, and I'm so excited. And this is going to be an amazing time for me. Anybody who's thinking about being respiratory, do it. It's not just passing breathing treatments, sticking for ABGs. If you want to be that respiratory therapist that looks at the patient as a whole, you can do that. Go in there, ask the nurses questions, collaborate with your doctor, ask the doctor why they're doing something the way they're doing it, or give them your opinion. You're going to have days where you feel like you are not meant to do any of this, and if you're going to healthcare because you care, you're going to have days where you feel defeated. But as long as you continue to go and show up and do your best everybody will know what your intentions are, and the future is bright for anybody who decides to do this. Any questions, feel free to comment and I'll be happy to talk. Thanks, guys.